Hello and welcome to another edition of Health Matters
and Health Focus.
My name is Anna Marie Sinatra from Sinatra Solutions, and I'm enjoying all your emails and your calls. We love hearing from you about all the programming that you want to see and all the comments about watching the program.
And I'm Ava San Marco from Health Focus.
And you know, we really want to thank our sponsor, Western New York MRI, where Dr. Frank Mascaro makes sure that he has the cutting-edge, state-of-the-art diagnostic imaging equipment so that when you find yourself in the time of need, you know where to go to get the best help that you need.
We're here at Lockport MRI, so stay tuned, get your pens and pencils ready, and we'll give you a lot of information that you can use.
Yeah, I'm really excited. We are here at Lockport MRI, and Dr. Frank is here with us, and he's going to tell us a little bit about this facility and tell us about all the other facilities that he has in Western New York, including a special new addition. Dr. Frank Mascaro, thank you once again for continuing to support Health Matters and Health Focus and being such a support to the community by bringing the community these cutting-edge, state-of-the-art equipment so that people have your places to come to when they need.
Well, thank you. It's great to be back on Health Matters as well as Health Focus. Today we're at Lockport MRI, and welcome to both of you. This is a great day here for Lockport MRI. We've done some renovating, trying to make a more pleasant place for patients to come and feel comfortable prior to their studies are done. And we hope everybody can enjoy their time here. Hopefully it's very short, not a long wait time. So I think it'd be important to keep the patients very happy and comfortable.
It's absolutely beautiful here. I've been here before, and you've put a lot of love into this facility. It looks absolutely beautiful. I'm noticing all the marble, and
Very
of course,
warm and inviting.
Yes, and just like at the other facilities, you've got coffee out for everybody, and the staff here is wonderful. You could tell that you've put a lot of love and care here.
Absolutely. I think it's important. Most people, you know, when they're coming for imaging services, are not feeling well. They're in pain. And we try to make it as comfortable as possible for our patients, and we try to, you know, perform their imaging as quickly as possible, so that they're not waiting around, and as well as their loved one waiting for them while they're having their imaging performed.
And if their loved ones are waiting, they get to watch the television screen right behind us. You have a nice big flat screen TV there.
It passes the time while you're waiting. It does pass the time a lot more quickly, and we have a little beverage center for people if they need something to drink or have a little coffee while they're waiting.
It's really nice. It's the pride and the love that you put in for the community. That's wonderful. So tell our viewers, because I know they're excited. They get to see who I'm always talking about every week, and you can give them a little bit of idea of all the different facilities that you have here in Western New York.
Correct. We're here in eastern Niagara County at Lockport MRI in the medical park right off of Davidson here. Downtown Buffalo, we're at Western New York MRI, Western New York PET CT, which are adjoining at Genesee and Michigan corridor, right next to the medical corridor. We're in Kenmore at Kenton Open MRI, where we have open MRI services. We're also over at Westside Imaging, performing ultrasound and X-ray. We're also at Amherst Diagnostic Imaging in Amherst. And most recently, we started our new breast imaging center, and it's Western New York Breast Health Center. It's on Sheridan Drive in Amherst. Great location, very, very nice, and it's spa-like. And really, it's a very comfortable atmosphere to have your mammographic examination, and we're very proud of our new addition to our imaging family.
Well, we're going to have to go there next and tape a show there, Ava. What do you think?
Oh, absolutely.
Yeah.
Western New York Breast Center. You know, that is so nice because, you know, mammograms, of course, all women know mammograms. You want to feel as comfortable as possible. And you know, when you have like a spa, like, oh, I'm going to have to go there. I think I'm going to go there.
I know I will. That's where I always go. I want to go where the best imaging is, and I know where to go where the best imaging is.
Right.
Absolutely, thank you. It's a very comfortable atmosphere. There we can give you digital full field mammographic examination. We have 2 units performing mammographic examination. We also have 2 ultrasound units. We have DEXA. If an assist aspiration or a small biopsy has to be performed, we can do it on site. Also, we're working in conjunction with Dr. Vivian Linfield, who's a very acclaimed breast surgeon in the Buffalo, New York area, in Western New York area. So it's a very, very nice, comprehensive breast health center. And that's what I think this area has been lacking. And Dr. Linfield's vision has really brought it to the forefront.
That's really exciting.
Exciting. Now, they can do, after they do the mammograms, they can do a biopsy?
They can. Yes, they can. Sometimes if it's somebody will come in with maybe a palpable lump that they just noted, and we'll go to ultrasound and we'll see, and is it a little cyst? Is it something else? Well, they can aspirate that little area and make sure everything's all right. Sometimes with the breast surgeon being right there, and if she's having office hours at that time, they can also be seen right away. And also, we can schedule biopsies with ultrasound as well as with MRI. We have the latest technology. All that can be done with scheduling right out of the breast center. Yes.
You just keep getting better and better. I know. I can't wait till we get there. And I know I'm always very impressed. I'm living south of the city, so when I need imaging, I come to the downtown area, which is very easily accessible. And you have all kinds of equipment there, including this 64 slice?
Yes, we have the 64 slice PET CT, which is very, very important in staging. If you have breast cancer or any kind of cancers, they can stage the cancer before you go to surgery or chemotherapy or radiation. So you know the extent of the disease before you start. And it's very important to know where you start and hopefully where you complete the therapy, and it's hopefully a very good prognosis.
See, I'm learning something new again today, too. That's what I love about doing our show. And I'll tell you, if I was in a situation that was, life-challenging, or even that big C word, big cancer word, I don't have the technical knowledge that you two have, but just listening to you, I know this is where I want to go, because what you're saying, I'm understanding, because I'm like your typical viewer. And I would want them, if they're going to treat me with chemo or radiation, to know exactly what you said, where it starts and where it ends, so that they're just not shooting all over.
Well, the important fact, shows like Health Matters and Health Focus is about early detection, getting the knowledge to people so they go to their physicians and find out, if they do have a breast cancer, since we're talking about breast cancer, to catch it in its earliest stage. And with our imaging tools, we can also help and assist in finding out at the earliest possible time when there is a problem. And that's the important thing.
And one of the things I always like to share so people know that we are completely authentic is that many years ago when because I live south of the city, when I needed some imaging done, my doctor said, I want you to go to Western New York MRI in downtown Buffalo. And I said, why? We have so many facilities out here. And he said, because they have the best equipment. And that was before I even knew Dr. Frank.
Thank you. We pride ourselves on trying to bring cutting-edge technology that is everywhere else in this country to Western New York. And sometimes people would say, well, geez, Western New York is lagging behind. Well, we're changing that tune now. We're getting the most technologically advanced equipment, so people in Western New York have the same opportunities, get the same quality health care that they do in anywhere, New York City, Chicago, Pittsburgh, anywhere around us.
Well, and we thank you for that very much. So we're going to, you had a question? I was going to answer, we're going to talk a little bit more about where we are.
The services, yes. But with the biopsy, and you can get it right away, and the PET scan to see where the tumors are. And I just want to tell you, that is excellent. Like Anna Marie, just to, say that, because time is just, you don't want to waste time. And that, I would, just for that alone, I would go to your center. Just for that alone.
We've developed a comprehensive way to take care of patients. In association with Dr. Linfield and everything she does, we can provide her with the imaging portion of the package on how to take care of the patient. You know, she's hands-on, she's the breast surgeon, but also the imaging helps her in seeing the extent of the disease and planning on the treatment, which is very, very important. So you want all that information prior to starting any kind of treatment.
Right, right. Exactly. Because time is, you know, of the essence.
So now here we've talked about the new place, and we talked about, oh, well, before we even move on to where we are now too, one of the things I remember ages ago when I had to go for a scan that was from the waist up, let's say, and I was just a little claustrophobic. I don't like to claim that. But the first thing that my doctor said then, too, was go to Kenton MRI because they have the open MRI. So for those of us who get a little, you know, tell us a little about that.
Well, Kenton Open MRI, we felt that at Western New York MRI that there were about 20% of the people having problems with claustrophobia. And basically, we opened Kenton Open MRI, or we kind of purchased Kenton Open MRI a while back, and it really served a purpose because not only does it have excellent imaging for an open, but also provided people an option. You know, some people could not get into an MRI. Right. Well, how are they going to get an MRI done? So an open MRI provides them the ability to have an MRI study done, giving, you know, their physician more information on how to treat them and, you know, helping their, you know, situation to improve. So it really, it serves a very, very important sector of people, and also some pediatrics where mom can hold the little, you know, little girl, little boy's hand while the MRI is going on. There's no radiation. It's magnetic resonance imaging, so there's no radiation. So it works out really, really well.
That is so sweet. I never even thought about that. You know, and again, like I'm the regular person who's watching, so, you know, I want to say that I really appreciated it. It wasn't intrusive at all. You could just lay there. You're going to see the machine in just a few minutes, the regular MRI. And it's so different at Kenton. We'll have to get over to Kenton so we could show you that one as well. But it is, it's very nice. And I could just tell by when you're talking too, the care that you have for the community and wanting to provide the best equipment and best service is just astounding.
Well, you know, it's very important to treat people. My motto is to treat people like they were my family member. I don't treat my family member any better than I would treat my patients. So that's very important because, remember, people aren't coming to you because they're healthy and they're feeling great. They're not feeling well. And, you know, sometimes it's just that little extra special care that you give a patient that, you know, it gives them the confidence to say, hey, they really care and they're really working hard to make me feel better. And, you know, that's what's important to us. And, you know, we're a local group of radiologists here and from Western New York, and it's very important to us to maintain that, you know, our friends and family and neighbors all get the same treatment.
That's incredible. And if you're watching today, know that you can ask your doctor for a script to go there. Doesn't matter where your doctor tells you to go. If you don't have a doctor who's up on all the latest technology like I do, I'm very grateful for my doctor, you can request. You could say, you know, I saw this show and I want to go to Western New York MRI. Or maybe you have a child. I never knew that. That is so incredible because children are always, they're scared to death.
Yeah.
And they can go in, you can go in and you can hold their hand. And
yes, very good. That cuts down on the anxiety, and they're more likely to come back if they need more tests, right?
Right, exactly. Usually, you know, we'll deal with, you know, younger children, not the real pediatric, because those kids won't stand still for anything. And that's very important for MRI, to stand extremely still. But if it's, you know, depending on the child, if it's a 6-year-old, a 5-year-old, depending if they're really mature and they can handle just sitting still for a few minutes and mom can hold their hand or dad, it works out. Usually we can get enough imaging to help out their physician and how to treat them.
that's awesome. So let's talk a little bit about where we are today, because I came all the way out to Lockport, simple to find, just taking the 990, getting off, getting down to Transit, coming down Transit, 2 little turns, and I was here to this beautiful facility. Again, I'm just so impressed with it. It's just, you walk in and you just feel peaceful. So tell us a little bit about what we're going to see today.
Well, first of all, we're here in Professional Parkway where there's numerous doctor offices. So we're located right in the hub of the outpatient doctor offices here in Professional Parkway in Lockport. And we provide MRI services at this site. We have a high field 1.5 Tesla MRI, beautiful imaging, state of the art, and we're very happy with what we have here at Lockport MRI to provide the people of Eastern Niagara County as well as Western New York that come here, as well as Canadian patients. That we get quite a few Canadian patients that come here to Lockport MRI.
And Ava, I know you and the doctor were talking your technical stuff. You were talking about tumors and different things.
Yes.
So.
I wanted to ask though, what is the percentage? I mean, can it really pick up a tumor in its beginning stages?
Sure. Basically, if you came in for a certain, let's just say an MRI of the brain, and usually it's pretty sensitive down to probably the 2 to 3 millimeter size, with if a contrast was added.
Right.
So that's very important. Usually it's, most doctors have an idea of what is going on with their patient, and we're really there to confirm a lot of the suspicions that their doctor has performed after a good physical examination. Right. So it's very important that we work in conjunction with the patient's primary care doctor, which really usually has a good suspicion, and then we kind of, give them the imaging that kind of substantiates their, clinical suspicion.
I just have one more question too. In what cases would you use the IV contrast? Why do you use that, let's say?
Well, IV contrast helps differentiate. Most tumors, be it breast or brain, usually start from normal tissue that has gone awry. So now we need that little extra contrast that usually a tumor will enhance with the contrast. So it'll differentiate itself from the normal brain parenchyma or breast parenchyma that's adjacent to it. So it gives us really more, sensitivity as well as specificity on detecting tumors.
Okay, here's the question from the regular layperson watching. So the contrast, that's something I haven't experienced before, so I could be of help to you two to break that down a little bit more for me. Like, what would that do? How does that look? You get an IV or you drink things?
No, it would be an IV. It's usually a small dose of what is called gadolinium in MRI, and it'll help differentiate, a tumor. And that it's very, very helpful in when it's used. Sometimes we don't use it, like MRI, we didn't need to use it in you, and that's a good thing. But sometimes we do use it, and it does tell us, well, everything's good too. So it's important.
And the doctor would make that call, or you would give your input too? How does that work?
Well, usually we look at all our scans, and then if we need it, we will use it. So, your case is, looked at by a physician while you're here at the center, and then we make that decision. And sometimes we already know pre-advance that we're going to use contrast, but most of the time we look at the scans and make sure that it's necessary to use.
And so you guys are talking about tumors and things like that. Is that the time that you use that kind of stuff more? Or?
Right, like Dr. Massara said, just to outline it, and to see where the location is.
Sure.
Exactly.
Sure.
Yeah.
Or sometimes in a recurrence, we want to see if, to differentiate, is it a post-operative change?
Right.
Because the body heals itself after surgery. Now, is that new tissue recurrence of the cancer, or is it just, reparative tissue like granulation tissue? So it helps us differentiate, because what is the alternative? Going back in.
Right.
So we try to give, the best description of what we see, and hopefully we work in conjunction with either the patient's primary care doctor or the surgeon that's taking care of the patient, and hopefully we can help the plan of the patient along. So
Can I
it's,
just have one more question?
Oh, absolutely.
Is, now by the position, can you tell at that point if a tumor is operable or inoperable? If you need surgery or not?
well, sometimes the location, obviously, you know, it depends on where the tumor is and how dangerous it is by going into surgery. Sometimes we can give the location, the size, the extent of the tumor. Sometimes they shrink it using radiation. We're talking in general terms, not anything specific, where they shrink the tumor down and then go in and do surgery. So that's helpful by telling the size of the tumor, the exact location, and where it extends to.
And I believe that I'll give you a little hint here because we want to help people as much as we can. That you were imaging, I think it was my back or some things, because I've been there for a few different things. And we found a small, tiny little tumor on my right kidney, and it's not cancerous at all. You were even able to tell by that. It was, I think I was told it's like the size of a pencil, a eraser on a pencil. So you even know by these imagings when they're not even a tumor that, what's it called, sebaceous? No, that's a cyst.
Was it a cyst?
That one was a tumor.
Was it a lipoma?
I don't know. All I know is it was like nothing to worry about, but we check it every year.
Sometimes by the characteristics of a tumor, and tumors can be benign or malignant, how they appear on MRI, we can kind of give a good, at least decision on, well, we've seen this before, this is what it is, and these are usually benign. But follow it up, because sometimes benign type of tumors can transform into a malignant tumor. And remember, every tumor is a little different. And sometimes by just looking like it's very benign appearing, can fool us. So it's very important to follow up. You know, some patients hear, well, it was benign, I don't have to go for follow-up. Really, it's very important to follow up. Follow up, listen to your primary care doctor, your surgeons, and they usually give a good course of action. But follow-up is very important.
Well, see, I'm getting prepared because my my annual physical is next week, and I'll be asking them about it again. And that's what we do. We take the scan every year and make sure that it's staying the way it looks. And, you know, folks, sometimes we don't want to be, we're scared, we don't want to know, what we don't know won't hurt us. But you know what? It's a preventative. You talked about the preventative. You catch something in its very beginning stages, you have a much better chance of taking care of it in an easier way than having to pay for it in a longer way.
Absolutely. I mean, early detection is so important to patients' health and to the way that we can treat things that can turn into something very bad, you know, and be more treacherous and more extensive surgery or more extensive chemotherapy. By catching it earlier, it's so much more important and increases survivability as well as, you know, what the patient has to go through.
Yeah, I think shows like this, not to fluff our own feathers, but it's the truth, shows like this and many other shows on TV too are really helping you to understand that this information is information you want to know. You know, the days of saying, no, I don't want to know, I'm not going for the test, whatever all those excuses are, only are going to get you in the grave.
More trouble, you know, keeping you in the dark. Remember what we said at the beginning, knowledge is power, right?
And only power if you act on it.
Act on it, exactly, and use it wisely. And that's what you need, and that's why we have shows like this, and to provide to the community so that they know, you know, even if you have a situation too, you'll know, you'll be informed, is what I'm trying to say. And it's better to be informed than not informed.
Yeah, absolutely.
You gotta know where you're going.
Absolutely.
Well, that's why your show is so special. It really provides information for the people out there in our community to better and improve their health care. And it's important that they see their physicians minimum of one, you know, for their annual examination. And when they're not feeling well, you know, to call up and try to get in and see your physician and let him make the judgment, you know, how you're doing.
You know, and it's the truth too, because here I'm going to help you all again too, because I don't depend on my physician to remember, because he sees how many patients between now and, you know, in a year from now. So see, I just feel so blessed for doing this show, because when I go next week, I'm going to make sure that I say, well, what about that little tumor we got to get? Because I'm actually a few months over past my yearly physical because I was seeing him for something else too. So, and then the other thing too is because heart disease is in my family, we tried last year to get me the 64 slice after I think Oprah, can I say Oprah? Oprah had that whole program on it, and then we did a program at your place showing that we do, in fact, have one of those machines here in Western New York, thanks to Dr. Frank. But my insurance told me no, but I'm going to fight them again this year. I'm going to get in there for it.
Absolutely. I think it's important. You want to be proactive, not reactive when it comes to your health.
Exactly.
And shows like, Health Matters and Health Focus bring you the information so you can be proactive.
Absolutely. Do you have another question?
No, I think we covered. Do you have any other questions?
Yeah, I want to see the machine here.
Oh, yes, I do too. That's right. And you know what, though, too, like you said about the closed MRI, I scoped that out immediately. For those of us that don't like the closed.
Oh, you too?
No, I don't like it.
Oh, see, we have that in common.
That's right.
I didn't know that.
No.
Yeah, you didn't.
Open space.
Yeah, I have a problem. I'm okay if they put me in feet first. I breathe. I think about being in West Palm Beach with the trees and the sun. But if you're going to put me in head first.
Oh, no, me either. What do they say that in Italian? Cupata, my mother says. Mati cupata, I can't stand it, so. Sorry,
so thank you very much.
Oh, you're very welcome.
Let's go see the machine.
Here we are now at Lockport MRI, and Anna Marie is our patient as she's going up and up.
Yes, this is our GE high-field 1.5 Tesla MRI. Anne-Marie seems very comfortable on the MRI bed, and it's state-of-the-art imaging here at Lockport MRI.
Wow, how you doing there? All right.
Anne-Marie's thumbs up.
Thumbs up.
We have our
trusty assistants.
Trusty assistants, Tammy and Tange, who are taking very good care of Anne-Marie.
Yes, they are. How you doing? Okay, time to put her in. No.
No, it's a very comfortable MRI here at Lockport MRI. We take special care in providing every comfort that we can for our patient so we can get the best imaging and help our patients the very best that we can.
If I ask, what is that clicking in the background?
Well, that's the hydraulic pump. That really, it's a high field magnetic magnet here. So it really it cools, and also it performs the electronics that are necessary for MRI imaging.
I see. And down she goes. Nobody knows.
My goodness, did I learn a lot today at Lockport MRI?
Oh, so did I. Even as a nurse, I didn't know all that.
See that? And I'm going for my physical, and I'm going to get some more scans. When is your physical due?
Oh, it's due now, but I think I'll go in another 5-10 years.
No, I don't think so. You better make that appointment and get yourself a couple scans.
Couple scans, but I know where I'm going. Lockport MRI.
And Western New York MRI, Kenton MRI, and a few others. So keep watching, keep taking those notes, keep sending those emails in, those phone calls, because we want to know who you want to hear from next. And don't forget, you can catch me the last Monday of every month where I'm offering workshops to help to empower you. So keep taking those notes, give us a call Dr. Mascaro, make your appointment today, because your health matters.
So stay focused.